So I'd throw open to the panelists as we talk about the future of healthcare, and we frame this in this conversation about accountability and accountable care. We've talked about reimbursement and briefly technology. Where does patient responsibility and accountability fit in? And most specifically, how would each of you suggest, as we think about the next chapter of healthcare, how would you encode in the work that you're doing or would suggest to be done to get that patient more engaged and responsible? And I'll throw it to Dr. James first.
You know, one little statistics that's very useful in this regard. Those are mainly those behavioral diseases. So alcohol, tobacco, sexually transmitted disease, obesity, violence and accidents primarily among young men. They're primarily diseases of the poor. There's a body of research that shows that the single most important thing in determining healthy behaviors is your education level. You will obtain more health benefit by investing in general education and producing more high school graduates and more college graduates, which will have a bigger population health effect than investing the same money in care delivery. That's one of the things I find most objectionable about some of our recent policy decisions in this country is it's, as we heard earlier, it's pulling money out of education to put it into care delivery. Foolish. In the extreme, if your interest is health.
Well, I don't mind exercising, except it makes me tired, it makes me sweat, and it makes me hungry. Other than that, it's not bad. We've got to find a way to make sure that the consumer, which I will always refer to as a patient, understands his or her part in this equation. It seems to me that until that occurs, there's not much that we can do because we can't impose things on patients. There's got to be a way. I understood the initial idea of an accountable care organization with the savings, the financial savings, were also shared with the patient. So we share with the patient the outcomes and so forth. We might be able to get correct incentives. But the bottom line for me is we've got to understand behavioral health because that's where the money is going to be found.
Andrew?
Two quick comments. In the beta version of the national fee-for-service payment model that the governor talked about this morning, one of the things that can significantly delay the transformation of fee-for-service to risk-based payments is a rejection by consumers of the accountable care movement. It's highly sensitive in the model that has been developed so far. Secondly, I sometimes wonder if the health exchange movement may do more to engage consumers in healthcare delivery than engaging consumers in healthcare delivery. And what I mean by that is we may exercise our biggest, our most significant choice as consumers in choosing the kind of benefit that we get and the amount that we will pay for it. And once we do, we will then subject ourselves to a care delivery system that provides for us a benefit and a delivery system commensurate with our choice. So I look for the exchange movement and the accountable care movement to really bring out the consumerism that we're looking for.
Fascinating reflections. Thank you.